Good morning. My name is Maria Crawford, and I am representing CareSource today. My territories are Marion County and the Donut Counties, and I include all of Indiana and suburban. So today we're going to be discussing a few different things. On your agenda that you see, you'll be looking at the provider payment processing, as we have a new vendor. Quality, so we're going to talk about HEDIS, key performance outcomes, surveys, resources, and access and availability standards. Our claim concerns, so corrected claims, the dispute and appeal process, and then some updates and reminders that we're going to hit on during the day. So provider payment processing. I apologize. So our provider payment processing, we have recently transitioned to Echo Health Incorporated. So for payment processing, they do provide the services of EFT and ERA for our providers, and they do have electronic fund transfers or EFT, electronic readmittance advice, virtual card payment, and or payment check. So you have a variety of options by utilizing them. If you would prefer to receive paper checks, you can contact Echo Support at 1-888-485-6233. Please note that for the security of your personal information, we cannot convert your banking information from InstaMed to Echo. That is something that you will need to do with them. Otherwise, it will default to the Quick Remit virtual card payment or the VCP or paper check. Echo does have available the electronic fund transfers and the electronic readmittance advice for you. You would need to, again, register with them, and we included a link on this. You're going to need your CareSource provider ID, so you can get that from the provider portal or by contacting our provider services number. You'll need your banking routing number and your banking account number. If you've already registered with Echo, have the following information available to expedite that registration, as well as your portal credentials, your tax ID number, and an Echo draft number and draft amount. You can use any of your corresponding draft amount issued to you by Echo to authenticate your registration. So note on here is when you're receiving or when you're signing up without a previous payment from Echo, you need to select the enroll using the enrollment code and then enter your CareSource provider ID as your enrollment code. So the standard credit card processing and transaction fees do apply when you're utilizing the virtual card payment. The fees are based on your credit card processor fees and your current banking rates. Echo does not charge any additional fees for that processing. So for each payment transaction, a credit card number unique to that payment transaction is either going to be sent to you by secure fax or by email. And then processing these payments is similar to accepting and entering in patient's payment via a credit card into your system. So we're going to talk a little bit about quality. So this year we have started going out with a different group, a different team, and they're going to talk to our providers about the HEDIS performance outcomes. I know everyone is very familiar with this, so we're not going over something brand new to any of our provider offices. We are going to be looking at 6 of the following domains of care for HEDIS. Those are effectiveness of care, access and availability, experience of care, utilization and risk-adjusted utilization, health plan descriptive information, collection utilizing electronic clinical data systems. So all of those measures can be described as administrative or hybrid, and it's going to be dependent upon the allowable collection methods. So your administrative measure is going to be coming from your claims or your supplemental data. only. Your hybrid is going to be collected through claims, standard and non-standard supplemental data, and then your medical record collection is going to be done if we cannot if found not compliant earlier. So if you are able to get the information from administration, we'll get it from there. If we can get it from either administration and or supplemental data, we'll get it from those two. But if we can't get anything else, we are going to have to contact those offices for that medical record collection. So some of the key performance outcomes for Hoosier Health-wise, you've got your well child visits, your for the 0 to 15 months, the visits for the 3 to 6 years, our annual well visit for adolescents 12 to 21 years of age. One of the big ones would be the lead testing in children. You have the first test between 9 to 12 months and the second test at 24 months. And then asthma medication management, which is a 75% compliance for 5 to 11 years of age. So in the key performance outcomes, you're going to see a mixture between Hoosier Healthwise and Healthy Indiana plan. So the adult preventative care is going to come out of your HIP plan. Your health needs screening for new members is going to be both. Emergency department is going to be both. Follow-up after hospitalization for mental illness, within 7 days of discharge is both Hoosier Healthwise and HIP. And then follow-up after an ED visit for alcohol or other drug abuse with dependents within 7 days of discharge. So this is a new measure for 2020, and that is going to be for our Healthy Indiana. We also would have the timeliness for prenatal care prior to 14 weeks or within 42 days of enrollment for our Healthy Indiana plan, as well as postpartum care between 7 to 84 days after delivery. So HEDIS, so in regards to our surveys, they measure the members' experience with their providers in their care and health plan. And some of the samplings of the questions that are going to be asked are on a scale ranging from 1 to 10. Give a rating of the primary care and specialty physician, getting needed care, getting care quickly. How well are our doctors communicating with the patient? And that's going to fall underneath that CHAPS and that qualified health plan member enrollee. So some of the quality improvement resources that we actually have out on our website are the HEDIS coding guidelines for the adult, pediatric, and behavioral health, our CHAPS improvement tips for general and pediatric, and then our clinical practice guidelines. Right now, we are actually going out and making outreach to our provider's office after hours. So yes, we get to work after hours. Yay! But what we're doing is we're making phone calls out to our doctor's offices to make sure that information is, when we call and we check on your after hours, do you have a provider for our PCPs? Is there somebody out there answering the phones, or can we get in touch with people? So for those access and availability standards, primary care physicians should be seeing patients with emergent needs immediately upon presentation, urgent care no later than the end of the following workday after the patient's initial contact with the PMP site, and then with our regular and routine care not to exceed 6 weeks. With our non-PMP specialists, you're going to need to, again, see your patients with emergent needs immediately upon presentation. Urgent care not to exceed 48 hours, and regular and routine care needs to not be exceeded by 12 weeks. And for a behavioral health specialist, emergency needs immediately upon presentation. Non-life-threatening emergency is not to exceed 6 hours. Urgent care not to exceed 48 hours. Initial visit for routine care is not to exceed 10 business days, and follow-up routine care is not to exceed that 30 calendar days based upon the condition. So one of the things that I want to bring up is with the access and availability standards is we are going out, we are making phone calls to our provider offices after hours to make sure that you have directed your patients to if it's an emergency, to go to call 911 or go to your nearest emergency room and so forth. So all of those are going to be going on at this time. If possible, and if we find an issue, our provider engagement specialist will be outreaching to those PMP offices to indicate what's missing from those conversations that we have at after hours. So just to let you know that. So if you want to reach quality improvement, you can reach them via Indiana Market Quality Improvement at CareSource.com, and they are happy to discuss HEDIS rates, quality initiatives, and potential partnerships with you. So how to resolve a claim concern. So what we've done is we've gone out to verify what claims and so forth that we're seeing come in and that are having issues. And that's how we created this presentation, part of the presentation. So claim status is updated daily on our CareSource provider portal, so you can check claims that were submitted for the previous 24 months. We have on here how to do that. So you would simply go to the www.caresource.com, log into your provider portal, and then you would go down to the member search and look up claim information. When that claim information pops up, you are going to see recipient ID, CareSource ID, member information, claim information, and you can submit information any of those different ways. So in addition to that, in addition, you have your determination or determined reason for payment and or denial, claim numbers and dates, procedure diagnosis, claim payment dates, view and print readmittance advice, and check status of claim disputes and or appeals. With your corrected claims, in the alignment with the IHCP claim adjustment policy, providers have 60 calendar days from the date of the EOP to submit a corrected claim for paid claim, even if that claim paid zero. A denied claim that is resubmitted with corrected information is considered to be an initial claim, as such is subject to the 90-day timely filing. If a claim is submitted with incorrect or unclear information, health partners have 60 calendar days from the date of service to discharge or submit a corrected claim. For your UB04s, the health partner must include the original CareSource claim number in box 64 and a valid type of bill frequency code in box 4 per the industry standards. On our 1500 forms, the health partner must include the original CareSource claim number on the right side of the box, code 22, and a frequency code of 7 on the left side of box 22. So claim disputes. So the definition for a claim dispute with CareSource is a provider's first response disagreeing with the adjudication of a claim. This is available for both our contracted and our non-contracted providers. All of those disputes must be submitted in writing via the CareSource provider portal or on paper. They must be submitted within 60 days after the receipt of the EOP, and they must be completed prior to requesting an appeal. If CareSource fails to render a determination for that dispute within 30 days, an appeal may be submitted. CareSource does allow you to submit claim disputes on our provider portal, and once you go into the website, go into your provider portal login information, you're going to go under providers, and you're going to click on claim disputes. Once you click on your claim disputes, you would fill in the information, enter the claim number, and click find. Once the provider portal identifies that claim, you can enter your dispute type. It might be incorrect payment, authorization, overpayment, so forth. You can attach any documentation supporting your claim dispute and add any necessary notes. And one of the great things that I like about doing the disputes online is you do get a reference number that we can look into and check status if you have not received anything. So for our claims appeals, there is an actual claim appeal form, and you can find it at the link on your top of this page. You may only submit an appeal after completing the dispute process. So you have to do the dispute process prior to the appeal. It must be submitted within 60 days of the resolution of the dispute determination, or if the dispute was not responded timely, an appeal must be filed within 60 days after that 30-day dispute window. CareSource must issue a written decision 45 days of receipt of the written request for an appeal. If CareSource does not resolve the appeal within 45-day time frame, the appeal will be determined to be in favor of the provider. You may submit via the CareSource provider portal at the fax number listed or by paper, and then timely filing appeals must include proof of original receipt of the appeal by fax or by the EDI for reconsideration. In order to do, you can file an appeal also through the provider portal. And instead of going into the claim dispute under provider, you would go into the claim appeals under provider and complete the following information. I want to basically state dental disputes and appeals cannot be filed via the CareSource provider portal. You must file them to the address below, which is a P.O. Box 1947, Dayton, Ohio, or fax the submission to 937-531-2398. And there is a claims dispute form out there for our dental providers at that link below. So updates and reminders. So newborn hospital stays that are billed by a physician group with current procedural terminology must utilize one of the following diagnosis codes as a primary diagnosis if the stay is related to birth. So this is something that we've started to see on our claims, so we wanted to bring that to you. There is coding guidelines and so forth at the link below if you have any further questions on that. Member billing is not permitted, so you cannot balance bill a member for a Medicaid covered service or billing a member in emergent situations. To charge a member for non-covered services, our health partners must disclose in writing that the service to be rendered is not covered by Medicaid, whether the procedures or treatments that are covered by Medicaid are available in lieu of non-covered services, that the health partner must offer on a disclosure form the member's willingness to accept financial responsibility of the non-covered service. The amount must be charged for the non-covered service and the specific date of the service to be performed. So the documentation must be signed by the member prior to the rendering of the specific service. So otherwise, Medicaid covered services cannot be billed to that member. Superior Vision is going to serve as our vision benefit manager for routine vision services. It was previously targeted on April 1st of 2020, and just due to life that is going on right now, it has been pushed back for an effective date of 6/1 of 2020. We just could not get this updated prior to the getting approval on this. So this presentation was already approved, so we just wanted to let you know the effective date has been pushed back to June 1st. So CareSource will remain responsible for medical optometry services. And then if you are not already participating with Superior Vision Network, we have included that network development department phone line at 1-800-981-2435 below. Notification of pregnancy. So it is an initiative that is to improve birth outcomes by identifying women enrolled in Indiana Medicaid programs in the earliest stages of pregnancy. Please note that the NOP must be submitted within 5 calendar days from the date of the office visit to earn that $60 initiative, and a patient must be less than 30 weeks gestation at the time of the office visit for which the NOP was completed. Please utilise CPT code 99354 with the TH modifier to get that approved. Lead testing. So currently approximately 50% of our members are approaching that 2 years of age have been verified to have received a lead blood testing. We think that this could be higher. So federal law requires a blood measure at 12 and 24 months of age for children who are enrolled in Medicaid. Children between the ages of 3 to 6 must receive a blood test immediately if they have not been previously tested for lead poisoning. Indiana does require persons examining the blood of an individual at any age for the presence of lead to report the results of the examination no later than 1 week after completing the examination to the Indiana State Department of Health by utilizing CPT code 83655. Beginning on November 1st, CareSource began rejecting claims prior to adjudication when the claim contained a duplicate modifier in the service line. So your EDI 999 and 997 HIPAA acknowledgement will include a message to remove the duplicate modifier from your claim and to resubmit. A retrospective review of claims is currently being conducted, and claims may be adjusted if they were paid in error. Corrected claims may be submitted for those claims included in the takeback, but you would need to make sure that you're hitting those timely filing guidelines. Our UB, as of October 1st of 2019, institutional claims required the attending physician MPI to be in box 76 on the UB04. Previously, claims may have been submitted with the provider group MPI as a rendering. Claims submitted without the attending physician MPI in box 76 is going to be rejected. So hospital prepayment claim reviews, we have contracted with Aquarian LLC to conduct itemized bill reviews specific to the inpatient hospital claims with the following. 1, if the total amounts are equal or greater than $25,000. Or 2, the diagnosis-related group or the DRG outliers. As of August 1st, CareSource may contact you requesting those itemized bills. Itemized bills are received and reviewed for applicable adjustments. A notice of claims review finding report will be delivered to our providers, identifying the line items and the amounts adjusted. Typical adjustment categories might include unbundling, billing errors, hospital-acquired conditions, experimental drugs and procedures, or implant markups. So if you have a question in regards to that, you can contact their claims resolution team at 1-888-895-2254 with those questions. We have had some pharmacy changes. So as of January 1st, prescription medication claims are processed through Express Scripts, and that Walgreens is no longer participating in the CareSource, HIP, and Hoosier Health-like pharmacy network. And if you've gone out to our website and onto that network notification and provider updates, a lot of this information that you're seeing here, you've already seen. We just wanted to bring it up just in case anybody hasn't gone out to that website, but please make sure that you are able to go out there and take a look every once in a while. So this isn't new to you. Retrospective authorizations for advanced life support as of November 15th of 2019. Advanced life support or ALS ambulance trips are required to have a retrospective authorization for services. Authorization requests must be submitted within 7 days after the date of the trip. Failure to submit a retrospective authorization for ALS services may result in a claim denial. So again, this is what I previously had mentioned. I kind of forgot there was a page out here for it, but visit the updates and announcement page that's located on our website for those frequent network notifications. Updates are going to include medical pharmacy and reimbursement policies, authorization requirements. Here recently, we've had provider portal updates that we were able to get network notifications out on how to attach documentation to those things that you're submitting on the provider portal. This is also a little bit new. So this is our provider health partner engagement representative map. So what I wanted to point out to you is we have different colors. So for regional representatives, the dark purple up in the left-hand corner, so our Lake County and so forth. Currently, we have an opening for a provider engagement specialist in that area. However, they handle those territories, but in the larger pictures, they also handle Franciscan Alliance, St. Joseph Regional Medical Center, such as myself in Marion County, and then the donut areas. I also handle all of IU and all of suburban hospital providers, as well as the hospital systems. So that's a little bit different. Off to the side on the top, you're going to see the management team leads. We have two behavioral health partner engagement specialists. Angelina Warren handles our northern part, which is why there's a yellow line, and then Stephanie Gates handles our southern part of the state. Brian Gersovich handles our ancillary associations and dental. He also works with our home health providers. So that's just a little bit of information on how that map works, just in case there was questions. Otherwise, thank you so much for listening through me stuttering through this presentation. If you have any questions, please don't hesitate to outreach to any of us on our map. We would be more than happy to help walk you through some of the changes.